Hi, my name is John Preston. I'm a professor at Alliant International University, and I'm on the faculty of the master's degree program, postdoctoral program, clinical psychopharmacology. And thanks for joining me. This is going to be a short talk, but I wanted to respond to an article that was put out by the Associated Press on August the 30th. And this reported the tragic death of one of our soldiers. He's actually a Marine, Colonel Andrew White. And in the story, it reported that Colonel White had been taking a number of psychotropic medications, including antidepressants, anti-anxiety medications, and an antipsychotic, Seroquel. And it further reported that the Seroquel dose was 1,600 milligrams, which, by the way, is a very high dose. It's significantly higher than the recommended dose. And the soldier was being treated for post-traumatic stress disorder and experienced some kind of drug or drug interaction problem and died from the medications. Obviously, a story like this gets our attention and concern, and certainly our condolences for his family. I want to talk about some of the issues that this raises. Okay, first off, post-traumatic stress disorder is being seen in up to 20% of people coming back from Iraq and Afghanistan, either clinical depression or PTSD. And so this is an extraordinarily common psychiatric disorder as a result of really horrific wartime experiences. PTSD, especially combat-related PTSD, oftentimes is very hard to treat and can disintegrate into a very debilitating and chronic condition. Now, my understanding from the article is that the soldier, the medications were really trying to target sleep disturbance and also recurrent nightmares. Nightmares are a special problem with PTSD because when they start happening, and oftentimes there's a replay each night of the horrific events that the person has experienced, fairly soon after the beginning of nightmares, then the person starts to become afraid about going to sleep, understandably so because they're reliving the traumatic experience again and again and again. There are no FDA-approved medications for the treatment of nightmares, although I will say, talk about this in a little bit, there are some experimental medications that show great promise. But sleep disorders in general are a huge issue in the treatment of PTSD. In this article, I think it raises several issues. Okay, the first is what's called off-label use, and this is where there's a medication that is FDA-approved for treating certain disorders. And Seroquel, this antipsychotic, is FDA approved for treating bipolar disorder and also schizophrenia. It's not FDA approved for treating anxiety or sleep disorders. However, if a drug which is approved for another disorder is used enough, and there's a track record of some efficacy and it's widely used, then it's considered generally to be ethical to go ahead and prescribe that medication, and that's off-label use. Seroquel is used widely for a whole number of different psychiatric syndromes, and oftentimes it can be very helpful, not just bipolar and schizophrenia. There is a pattern of practice in the United States currently where they're using Seroquel more and more to treat sleep disturbances. It can improve the quality of sleep both by providing sedation and also has a fairly unique feature of increasing the amount of time spent in slow wave or deep sleep. So it sounds appealing. At the same time, Seroquel does have a number of significant side effects and is not the first-line medication for a sleep disorder by any means because it can be potentially dangerous. Another issue that is raised is polypharmacy, using a number of medications to treat disorder, not just one. Here, this gentleman was treated with at least 3 classes of medications: anti-anxiety, antidepressant, and an antipsychotic drug, plus the reports that he was taking prescription pain medication, but he did not have a prescription for that medication. Now, polypharmacy, using a number of drugs to try to treat a condition, again, is very common, and oftentimes it's necessary in treating very severe psychiatric disorders. This is very much true with bipolar disorder, for instance, where many people are taking 3 or 4 drugs. So it's legitimate in many cases to do that. But the critical factor here is how this is approached. Generally speaking, if somebody has a very severe and treatment-resistant disorder, they will be treated with one drug initially if that drug shows some effectiveness but not stellar performance. Let's say it's not a home run, but it gets someone to first base, but they still have considerable symptoms, then it is appropriate, and oftentimes this is done, where you might add a second medication. and sometimes even a third. Okay, now this should be done in a very systematic and sequential fashion, because every time that you add a medication, you have set the stage for drug interactions. This is a problem. I think this is a problem with this case because uh, it oftentimes is known if two drugs interact with one another, because there's data on that. But when you have three or more drugs, then it becomes extraordinarily complicated. And there's really no pharmacist or physician who can, with great reliability, be able to predict complex drug interactions, and especially if a person is taking a medicine in addition to what they've been prescribed. So in this particular case, the use of several drugs in itself may not necessarily be the problem, but we don't know how they got there. Was this done in a careful, well thought out, and systematic fashion? And that's completely unclear from the newspaper article. Uh, but the next issue, I think, is worth consideration, and that is the dosage on Seroquel. Typically, the highest dose of Seroquel used to treat very severe psychotic disorders is around 750 milligrams, and this soldier was taking 1,600 milligrams. So it raises a question about several things. Number one, uh, were the doses too high, especially in the antipsychotic? Number two, were the drug interactions being monitored carefully? Number three, was it absolutely necessary to go to these extremes to try to treat the symptoms? Now, that's hard to know because we don't know how much suffering uh, this gentleman experienced over a period of time. There might be occasions when a competent psychiatrist would push the dosage or use multiple drugs if nothing else was working. Okay, so these are the questions that are raised. And there's a final question, and that is, are drugs necessary? Now, oftentimes they are, but there are some bona fide treatments, non-medical treatments, psychological treatments, one of them called imagery rehearsal, that have a good track record showing efficacy in treating nightmares. And there was no mention about non-medical approaches, but I think absolutely before you go out on thin ice using multiple medications or using extraordinarily high medications, that some of these other approaches should be tried. And then finally, there is a drug called Minipress. This was a drug developed to treat high blood pressure a number of years ago and has been found just by happen chance to be very effective in treating nightmares. And it's being used widely by the Department of Defense and by the Veterans Administration, and I'd be very curious if they have tried that medication, because it has some research support for targeting and successfully treating nightmares. So these are the issues I think that are raised. Aside from just being disturbed by the outcome in this, aside from great concern about our returning veterans, who are many of them suffering terribly, the whole issue is when you read an article about this, is to ask the question, how careful and systematic is the treatment? And keeping in mind that it's always dangerous if somebody adds a drug that they're not prescribed, and that in the hands of the most competent physician. When you start having more than two drugs given at the same time, especially at higher doses, it's very difficult to predict what kinds of consequences are going to be in terms of drug interactions and idiosyncratic responses. Some people are just exquisitely sensitive to certain kinds of side effects and to drug interactions. So I think this is worth taking a closer look at. Thank you for joining me. Bye-bye.